Well, we're back with a new episode of Talking with Doyle. I'm Hunter Kipe, and I'm with State Representative Doyle Heffley and special guest Representative Sheryl Delozier. Doyle, what are we talking about today?
Well, as the chairman of the Human Service Committee here for the Republican caucus in the State House, we're talking a little bit about what the committee does, what Human Services does. I mean, it's 40% of the state budget, and how those funds are driven out through the counties to provide services in the community. And Shirley, you are the representative of the
88th District.
88th District,
Yep,
Cumberland County.
Cumberland County. It is a county that is the fastest growing county in our state. So my interest in human services is obviously with that growth in population. Our county is going to need services, and there's going to be more people that are asking for those services, and to better understand the budget process as to how we serve our folks. And you know, when you think of human services, as you mentioned, 40% of the budget, that's huge.
Yeah.
And when people think of human services, you know, stereotypes come into as to what a human service is. Because I'd be interested, you know, for everybody that's listening, as to what is the breadth of human services, because people just think it's a certain age group maybe in our population, but it really covers, you know, end to end, and so that's why it's 40% of our budget, because it covers so many people.
Yeah, I mean, with the committee and primarily some of the things that we oversee, and we just held a hearing on the Centers of Excellence. So we cover DDAP, Department of Drug and Alcohol Programs, so substance use disorders. We deal a lot with behavioral health funding for folks that you know have those needs, and we also intellectual disabilities. So those caregivers that go out in the community. We also have a health committee that deals with the health part of it. Some states will have a health and human services. We split that up because human services is such a large part. It's almost $20 billion in state funding that goes into that, plus a lot of federal dollars on top of that. And then we have the opioid settlement dollars that are also driven out through the counties for human services.
No, a lot of what we were talking about with the opioid settlement and the dollars that are driven down to our counties, and the capability of recognizing that additional dollars come over above what the budget sends. Opioid settlement is one of those. I know in Cumberland County, in the first year, we received $850,000 from the settlement, and I know it will vary each year. But can you talk a little bit about like what that opioid settlement can be used for? Because I think there were some questions at certain times as to what those dollars could be used for.
So Exhibit E in the settlement kind of breaks it down for the counties to say how they can use those dollars. I know a lot of counties use those dollars to help with drug courts. It's the specialty courts are important, right? We have veterans courts in many counties, we have drug courts in many counties, and now we're having mental health courts or behavioral health courts in many counties. But the opioid settlement dollars can go to help fund if you have a drug court. It can also go to help fund treatment. So those dollars can go to somebody that's struggling with an opioid or a substance use disorder. It can also be used for fentanyl. So we've kind of phased out of what you would call the opioid crisis. It's still an issue, but right now what we're seeing, the drugs on the street is really fentanyl. A lot of methamphetamine and fentanyl. Right. I mean, we lost about 5,700 Pennsylvanians last year to overdoses. I think the statistic from 1999 to now, over 1 million Americans died of overdoses in that time frame. Last year alone, in the nationwide, 122,000 Americans died of overdoses, and about 90% of those overdoses are linked to fentanyl. So that really is the crisis, and we're seeing it here. Now you have xylazine, which they're adding to the fentanyl, which creates like a zombie-like effect. It's horrendous what's going on. But those dollars, those opioid settlement dollars.
It's a true chemistry.
Yes. Yeah.
You know, when they're working on it.
Yeah.
Does that also include education purposes with that funding?
Yes, it can be used. It can be used for education, for treatment. You'll see signs and billboards up. A lot of it. I mean, look, the opioid crisis was really focused around two things that we had going on in the nation at that time. One was the very liberal prescribing of opioid pain medications. Percocet, OxyContin was very. We started treating pain as a vital sign, and everybody their pain threshold, and we just really started prescribing a lot of opioids as a society. And because of that, we've seen a lot of people that got addicted. I mean, the pill, OxyContin, Percocet, that's the pill form of heroin. It's the same people are doing heroin. That's what that is. And a lot of people didn't understand that. Unfortunately, a lot of young people sports injuries, and they would get addicted.
Because it was prescribed by a doctor, they thought
Yeah.
it was fine, and they
Yeah.
didn't realize. I know that
Yeah.
seeing a lot of folks that do that, oh, well, the doctor said I could.
Yeah.
Yeah.
So therefore it was okay versus, some buying it from a drug dealer per se, and they know it's illegal.
Yeah.
So
And-
they had permission.
Yeah, they think
And-
it's okay.
Yeah.
And you and I, we worked on that together.
Yes.
Back in, I think it was 2014, 13, 14, we passed the opioid, a package of legislation. And in 1 year, because we passed prescribing guidelines for opioids, we cut down on youth prescribing of opioids by 50% in 1 year.
Oh, wow, I didn't
and that
realize
was
that
a
statistic.
significant reduction. So we can, like legislatively, work on this. It's unfortunate that the crisis happened. Mix into that then the black tar heroin that was coming out of Mexico, very cheap, and it was a perfect recipe for disaster. But we addressed that, and now going forward, and we're seeing some of the remnants of that now with fentanyl, because that's a synthetic opioid. It's much more powerful. So those dollars can be used for that as well. But as we go forward, now we're working on legislation and different things to combat the fentanyl crisis, the xylazine crisis, and also leading into that, you have a behavioral health crisis. We're seeing more and more people coming in for those needs. So those are all things that are putting a lot of stresses on human services throughout the Commonwealth and getting additional dollars. But as Republicans, people say we're not compassionate. We are compassionate. We do care. We care about the folks that need those services. But at the same time, we want to make sure that these state dollars that we're allocating are going for the right purposes. And
to the
that's-
right people.
And to the right people. It's not just a matter of throwing dollars at a problem. It's making sure that we're targeting that funding to actually work in our community.
And I know sitting on Judiciary Committee for many years, one of our biggest frustrations was the fact that we couldn't keep up with the bad guys, with legislation to help our law enforcement prosecute all these chemistry mixes of drugs. And every time we would pass a piece of legislation that said anything mixed with fentanyl, to use that as an example, is illegal, well, then they just tweak it a little bit and make the combination really not fentanyl, but something a little bit different, but then it wasn't able to be prosecuted as well. But one of the things you mentioned just a minute ago, which I think is important, that I hear very, very commonly with those that do need services, you mentioned beds and the capability of getting inpatient services. And I know Cumberland County has teamed up with Dauphin County to receive a grant to be able to provide more services and to do that together for our central Pennsylvania residents. So I guess I would ask the question as to the fact of, there are things that we need to do better and help our human services to achieve. And we've worked on that. You and I know many times with different types of bills. And you as a chairman, I think, is a great example of the fact of you're very aware of what we do well, but also where there is a gap and where we as a state and need to do a little bit better. Can you talk a little bit about what some of the things are we're working on to try and help our counties and help our residents?
Well, I think one of the biggest needs right now are, like you said, inpatient beds.
Right.
We're seeing a lot of issues in hospitals, in emergency departments, where people come in, they have a physical and a mental illness. And they can take care of the physical,
Right.
but they can't always get them the services. The hospitals can't provide those services there. So trying to find them a place
Longer
to
term.
go. Yeah, and with the closing of many of the state hospitals is really putting a burden on those our networks now. So we are helping to provide hospitals grants and other resources, and they're expanding and building out their capacity because they see that need in the community. The other part of that is looking at how we pay for those services. So people are familiar with how when you go to the doctor and you have to have an MRI or you have to have a test done. Your insurance then covers that cost. Doctors generally have to get some kind of approval, and then the technicians have to put a code in the computer system so that it's paid out, and there's certain requirements that the insurance companies have. So how that works out for behavioral health is we have a shortage of workers, right? It's one of the another.
Right.
We have
Big
beds
issue,
shortage,
correct.
and we don't have the staffing. So how can these networks provide these services, and what laws or regulations do we need to tweak so we can make sure that we have people that are there that can provide those services, and at the same time that the hospitals or the healthcare network can get reimbursed for those services, because it's not free.
Right.
And now with the labor costs have skyrocketed. The people, if they're going to do that job, they want to be paid, and hospitals need to be reimbursed. So that's one of the things we're working on now is how do we get the hospitals reimbursed for that.
Okay. And employment, I think, is a huge issue across our state, no matter what field you're talking about. But human services, talking to so many families that are receiving services within my district, but also, they want to keep their folks at home. They want to keep their child, if it is someone under 18, if they, or in some cases, actually, they're a grown adult, they could be in their 20s, but they're still, at home because they possibly can't live on their own, but they don't want to put them in any kind of formal housing. They want to keep them at home. So those folks that come into our houses that provide those services, we have had many meetings with those that provide those services and their capability of getting reimbursed and their salaries. I think that's a big issue.
One of the things that we're going to advocate for in this budget cycle is to get those increases so we can bring those salaries up of those home health care workers, because it's a continuum of care. Somebody goes to the emergency department, they have an issue. They get admitted to the hospital, and
which is the most expensive.
Yeah.
The hospital is the most expensive, so we don't want them there.
Yeah.
We want
So
them out.
If they're well enough now, maybe they need to go to rehab. So they need to go to into an assisted living or a long-term care facility. But the long-term care facilities are struggling because they don't have the staffing. So if they can't get that person from the hospital to the long-term care facility, that backs up in the emergency department because now you don't have the beds. The next part is the long-term care facilities, when somebody's reaching the end of that, and now we need to go into some home health care services. Well, if you don't have those home health care workers to provide those services,
Right.
a person doesn't get dismissed
Released.
from the long-term care, doesn't free up a bed for the hospital, so the hospital can't free up a bed for the
chain
patient.
reaction,
Yeah, it's a
right.
chain, so it backs up. So that's why we need to ensure that we're not putting artificial mandates on hospitals, that we're allowing hospitals to create opportunities to provide that quality care without over-regulating and over-legislating them, so that they can figure out how to provide services. I would say I think every doctor, every nurse, everybody in the healthcare, and most people, I'd say 99% of the people, when you wake up in the morning and you go to work, you want to go to work and do a good job. Nobody says, I'm going to go to work today, I'm going to do a terrible job.
Yeah, exactly.
Well, what we need to do is we need to provide, and what the state can do is provide the resources and the opportunities for those networks to provide that level of care for the community.
Well, and many times when we are talking about different types of care, one of the things that has struck me is the fact that our folks within our counties, they run the system, as you mentioned earlier. And when we've had numerous conversations with them, the ability to take a look at drug and alcohol versus our children and youth system. So our children and youth system, as I was the former chair of children and youth, and that was certainly eye-opening to me in how that system works, and how we do need to have some reforms in our children and youth system, and whether it's foster care or the one that always hit me was the aging out process. When someone hits 18, then they're on their own. But how are we preparing our students for that? How are we preparing our the system? And is there a way to do that warm handoff versus just, oh, you're 18, you're done? And I know as I worked with my fellow Democrat chair and Pam Delicio, and we were absolutely 1,000% in agreement as to the fact that our children and youth system is fragile and one that really needs to be taken a look at to make sure that our kids are getting served the best that they can. And I know we have a separate committee with children and youth that deal with that more than human services, but a lot of those children are receiving human services because of the situation that they're in. So we're talking about folks that we're talking about our children, we're talking about middle age, it's those with intellectual disability, we're talking about our seniors, and it's very easy when we're looking at different things to say, oh, well, we spend too much money on human services. But when you take a look at who is served, it does say human services, so it means all humans. And I think a lot of people don't recognize that the breadth of what human services does, and how many people it touches in our Commonwealth. We have so many, over 13 million people, and I think a very large part of that population receive services that would be claimed as human services.
Yeah, and it is an important. I mean, and as a society, as conservative Republicans, I think I want to make sure that if somebody needs somebody to come into their home a couple hours a day to help them get out of bed, maybe bathe, and do those basic things, so we can keep them living in their home.
Right.
I don't think most taxpayers are going to say we don't have a problem with providing that service, right? But if there's
the most vulnerable
the
people,
most vulnerable
right.
people, and I think that is a good use of state resources. But we also need to make sure that the people that are charged with administering that are using those dollars, because everybody always comes in, everybody wants more money, and sometimes throwing more dollars at it. Sometimes it's just regulatory changes, but really we want to provide a quality of life and dignity for the people that need those services, while at the same time being very respectful of the taxpayers. And I think your time on as chair of the Children and Youth Committee, you have really an appreciation for the complexity in children and youth services. And I mean, one thing that the state does is the state provides the counties up to 80% of the salaries for the people in Children and Youth. Children and Youth has a very high turnover. I mean, it's to work in that.
Job.
It's a difficult job because you're seeing the worst of the worst,
right.
and children are involved. So it's
what
very,
people do to their children.
Yeah.
It just can blow your mind. And
so as a society, when we work on legislation, we want to make sure that protecting those children, while at the same time, trying to provide them the opportunity so they can get back to where they need to be.
It is evident that care doesn't stop. It's definitely full-time, whether we're talking about, children, teenagers, seniors, grown adults. On a more broad sense, Doyle, what are your goals for human services this year as we're talking about the budget? And then even getting more specific, Sheryl, what are your intentions and goals for Cumberland County moving forward?
Well, I think as we look at it, it's not always about we need massive increases. I think some increases in reimbursement rates is very important, so we can find the staffing to provide those services. But then at the same time, continuing to take a look at regulation. I mean, sometimes we have bureaucrats that have been lifelong employees of these agencies here in Harrisburg, and they do what bureaucrats do. They just come up with new regulations. How can we look to tweak those regulations and provide some flexibility for the providers? But at the end of the day, it's not about regulations, and it's about making sure that the person that's relying on those services can get them, and the taxpayers can afford it, and that they have a quality of life. So I think that's something that I've been advocating for, and you'll hear me speaking later today in the budget hearings about that. I mean, I think also looking at being a little bit more. I think our departments need to be more proactive when we're looking at the fentanyl and the xylazine and the other things that are coming down the road when we talk about substance use disorder. And I think sometimes they just they fall down a rabbit hole, so to speak, of regulation and, we can't use that, we can't do that. And we need to get out of that mindset and just start helping people. That's what I'll be advocating for.
And I believe, as it comes to our counties, and obviously I'm biased towards Cumberland County, and it's a large county, and it's a growing county. And, at this point we're, 257,000 and growing. As the boom of houses being built and apartments being built in my neck of the woods continues to happen. And I don't know where all these people are coming from, to be perfectly honest, but we keep growing. And to what Doyle's point is the fact of, is another dollar what we need in Cumberland County? In some cases, yes. But the flip side of that is also, I want to be able to take a look at when we do get an opioid settlement, that our county government is looking at the big picture. As to the fact of how can we invest these dollars in the best way possible to have the longest effect. How can we, we have a growing population. Okay, great. Well, our growing population will need what services in 5 years? Rather than, we say this many, many times, especially with state and federal dollars that go down, whether it's to our schools, whether it's to our counties, whatever, it's driven down, but they're one-time dollars. These are one-time dollars that the opioid settlement's great, but it's not going to be here forever, and it will be, a number of years. But where can we invest these dollars for a long-term effect long after the dollars run out.
Yeah.
Where can we put these one-time dollars to the best impact? And granted, providing services is a great thing, but if we hire 24 people with these one-time dollars, where are we coming up with those funds in the future? So that big picture viewpoint for Cumberland County, and any county, any of our 67 counties, I'm hoping that our county commissioners, our county workers that are overseeing, whether it's children and youth, whether it's the drug and alcohol, whatever portion that they oversee, that they're trying to look for how can I make this money help now, but also down the road, say, oh well, since we invested in this, we don't have to do this, and make that trade-off. Because look, I get that the dollars don't go very far.
Yeah, and we had allocated $100 million in 2 budget cycles ago, and then to do just that. So a lot of the dollars that we're seeing right now, the opioid settlement money, or the additional dollars that are still coming from the COVID relief funding, that's one-time money.
Right.
So one of the things that we had worked on and you voted for that when we passed that bill over to the Senate, was to take those dollars and allocate it to infrastructure, helping networks that want to build out inpatient beds so they could have a grant program to apply for. Also, the other thing was to pay for reimbursement for people that want to work in that field, psychiatrists, psychologists, counselors. So if they go to college, they can get, if they sign up for so many years, 10 years or 12 years to work in state, that they're going to get
that back,
tuition
deferred,
paid off. So so that's an investment, because now you got somebody that we helped to pay their tuition, so they're going to be here long term. They're not just going to be there 10 years. We're hoping they're going to be there 20 years. If you build a bed, an inpatient bed, that's something that the networks then don't have to pay for, so you don't have that cost down the road.
Right.
And that bed will be there for hopefully 10, 20 years providing services. So I think that you're really use those one-time dollars. I've always advocated for capital projects, capital investments, whether it be in personnel,
not staffing or something that is going to have a reoccurring cost.
So, well, I thank you for coming on, talking with Doyle, and certainly look forward to continuing our discussion.
Thank you. It was great.